Hello, welcome back to our series Hospital Rounds. Just as nurses and doctors have to round on their patients to ensure timely care and check up on their care journey and let them know how it's going, so we are rounding on our clinics, on our units and departments to keep our community in the know and up to date on how things are going at Hillsdale Hospital. Today, I'm so excited to welcome as a guest Rihanna Pickering. Rihanna, please introduce yourself and the Hillsdale Health and Wellness Clinic to our community.
Hello, everybody. My name is Rihanna Pickering. I am a psychiatric nurse practitioner as well as a family nurse practitioner. I work at Hillsdale Health and Wellness. I've been here for 10 years now. We are a primary care clinic, we are a walk-in clinic, and we do outpatient behavioral health as well.
Perfect. Thank you, Rihanna. I'm really excited because we're going to kind of walk through the clinic today, meet a few different employees who are really key to your patient experience here at Hillsdale Health and Wellness, or as we refer to it, HHW. So come along with us to meet some staff. We are now at the check-in process of primary care and walk-in at Hillsdale Health and Wellness. This is Annabelle. Annabelle, can you please introduce yourself?
Yes, I am Annabelle Kais. I'm the medical office receptionist for Hillsdale Health and Wellness.
Yeah, so you're the first face that a patient might see when they walk in the door.
Yes.
But before they walk in the door, how do they schedule an appointment if it's for primary care or like a same-day appointment versus walk-in?
Yeah, so you can call the office at 517-437-7040 to get an appointment. You can MyChart message if you're set up with that. If you aren't, we can definitely help you set it up. It's just a simple process.
Perfect. That's great. So it's pretty easy to make an appointment.
Yeah.
What about if they're making their first appointment ever here? Can you kind of walk them through that process?
Yeah.
Okay.
So if you have never been seen here before, we might have to make your chart. So it's super simple. You just give the first name, last name, and your date of birth.
Okay.
And then we'll set your chart up. We'll ask for your address, your phone number, any other important things that we would need to contact you. And then if you don't know our providers, you can definitely ask. We'll give you a little rundown of who we have, and then we can get you set up with an appointment.
Perfect. Thank you. Yeah. So when a patient actually gets here and walks in the door, what should they bring with them? What do you need to kind of get them started in their appointment?
Yeah. So we'll ask for your driver's license, your insurance card. If you are a guardian or a POA for someone, we do ask that you bring in that information so we can get it in the chart.
So a POA, power of attorney, can you explain that a little bit?
Yeah, so that's just giving access for someone to help with your information a little more if you're more unable to do that yourself.
Yeah, so like if a family member of mine, you know, maybe they go into a coma, unfortunately, or something like that, and they have me as their POA, I can help make those healthcare decisions for them. Okay, that's great. Let's talk a little bit about the process of checking in. What comes after that once they've kind of given you everything that you need?
Yeah, so once I get everything that we need, like the signatures, the consent forms, I'll have you sit in the waiting room and wait to be called.
Yeah, that's great. Pretty simple. And then they get called back. What about, since this is a walk-in clinic, sometimes we have some illness. So do we require any kind of infection control for that?
Yeah, so we do provide masks here in the front. If you ask for one, we will definitely provide one. If you have any respiratory symptoms or any like flu exposure, COVID exposure, you can definitely get a mask to wear. Any cough.
Perfect. Yes. Thank you so much, Annabelle. Thank you for the work that you're doing here.
Yeah, of course.
Now we are back in the hallway at a patient room. This is Miranda, an MA at Hillsdale Health and Wellness. Miranda, can you introduce yourself for our audience and talk through a little bit of your responsibilities here?
Yeah, I'm Miranda. I'm a medical assistant here at Hillsdale Health and Wellness. I've been here for about a year. I help out with both primary care and walk-in. So typically what we do is after they get all checked in, then we will go ahead and go grab them from the waiting room, make sure we get their height and their weight, and then we'll bring them on back to our patient rooms here.
Perfect. Let's actually go in a patient room and we'll talk a little bit more about what happens next.
All right.
So Miranda, here we are in a patient exam room. How many exam rooms do we have here at Hillsdale Health and Wellness, and how many providers do we have?
So we have, we have 11 exam rooms. And for providers, we have our medical director, who is Dr. Heather Muse. She goes to a couple of different clinics, so she's here a couple days a week, but not every day. As for every day, we have Jennifer Blonde, Rihanna Pickering, Scott Hubinger, And then Christina Old, she is primarily on walk-in schedule.
Okay.
So the other ones kind of help out throughout the week for both
Great.
primary and walk-in.
Yeah.
But
and all of those providers who are doing primary care, not just walk-in, are accepting new patients pretty much all the time. So if you're looking for a primary care provider, here would be a really great place to start. Can you tell us a little bit more about walk-in care? What kinds of symptoms might bring a patient in for that kind of care?
Yeah, so for walk-in, we usually see people for a lot of sickness, especially around this time of year. A lot of runny noses, stuffiness, cough, fever, that kind of stuff. And then also see different things like UTIs, more of like the smaller stuff that maybe they're not able to get into their primary care, but also not necessarily an emergent situation.
Yeah. And if someone comes and kind of turns into an emergency, then you take them over to the ER.
Right. Yep.
All right, great. So here we are in this patient room. This is kind of where a patient would sit, correct?
Correct.
And you would be the first point of contact for that patient after they check in. So what do you do with the patient as soon as you get into the room?
So typically, either while we're getting their height and weight or when we get into the room, we'll introduce ourselves, kind of let them know our place here. So I'd be like, hello, my name's Miranda. I'm a medical assistant helping you get ready to be seen through the walk-in or seeing a certain provider. Okay. And then we'll kind of go over what they're being seen for and get their chief complaint, kind of see what information we're needing to gather before the provider comes in so that way they can review it. Okay.
And do you take like blood pressure, things like that?
Yep. Okay. So after we kind of go over their chief complaint, we'll some people do vitals first and kind of see how everything's working, get temp, blood pressure, heart rate, oxygen, all that fun stuff.
Yeah. We are now back in kind of a new space for Hillsdale Health and Wellness. This is the outpatient lab. We're really excited about this space, about being able to provide this care here as part of the primary care journey. But first, let's meet Donna. Donna, can you introduce yourself?
My name is Donna Jeffrey, and I'm a phlebotomist from the laboratory at the hospital.
Perfect. And we've only had this lab here for a little bit. Can you tell us about what kind of motivated that decision?
The providers really pushed. The providers here and the leadership at the hospital really wanted to expand offerings and be able to provide services to patients who may have transportation or time limitations or other things that might prohibit them from getting their lab work done.
Yeah, that's perfect. So when someone comes for either their walk-in or their primary care visit, if a provider wants them to get some blood work done, we can say, just wait, come over here to this room, we'll get it done right now, and that's super convenient.
Yes.
It's really nice. So I'm assuming everything is billed all the same way as it would be elsewhere if you were to go to like the main hospital location.
Yes, I use the same computer system as the hospital laboratory, so it is a separate bill from wellness clinic, but it is billed exactly like you would if you had gone to the outpatient lab at the hospital.
What if a provider orders labs, maybe it's not a Hillsdale Hospital provider or it's not from HHW, can you still come here for those labs?
You most certainly can. As long as I have a valid lab order with a doctor's signature on it, I can take care of you here at this outpatient lab.
That's awesome. And is it usually a pretty quick process in and out?
It takes probably 12 to 15 minutes because I have to register you, and that takes a few minutes to get that process done. And then the lab draw itself is usually pretty quick.
Yeah, but you're not waiting in a line or anything like that.
No, not usually.
Okay, that's great. So what are the types of things that someone that a provider might be looking for when they order blood draws here at Hillsdale Health and Wellness?
It's pretty routine to have what's called a complete blood count. So that's like your hemoglobin and your hematocrit and all those numbers. There's another one called a complete metabolic panel, and that's like your electrolytes and your glucose and different metabolites that we all have in our system, and they're just checking the levels to make sure that they're within normal ranges. We do thyroid testing, cholesterol testing on your urine, all things that can be handled here.
That's amazing. And how does a patient get their results once they leave the clinic?
Multiple ways. The providers here, their MAs, reach out to the patients and give them a phone call and let them know either whether you're in normal ranges or there's, this was a little low, this was a little high, and then any follow-up that may need to be taken because of lab results. The results also do flow over to my chart,
Oh,
and the Hillsdale Hospital has its own portal where you can also access your lab results.
yes, that is just so convenient. It's so nice to be able to log on and see your full health journey and history right in one place. So if I come and maybe I'm not set up with something, either the hospital's portal or my chart, can someone here help me get set up with
Certainly.
that? That's wonderful. Thank you so much, Donna,
Yes,
for
thank you.
being here, for doing such great work for our
Yep,
patients.
thank you.
We are back with Rihanna. Thank you so much for being back on, Rihanna.
Absolutely. Thank you for coming out.
Yeah. So we're going to talk a little bit about the role of primary care in healthcare, and also what kind of the process is like for a primary care visit when a patient, after that MA, kind of walks out the door and when you come in. So first, let's talk about that.
Okay.
What are you looking for when you walk into the room
for?
with a patient? What is your priority, and how does that visit kind of go?
Okay. So my priority is definitely figuring out what the patient came for. So it starts out, if there's a chief complaint and it says, this is what brought me to the office today, and this is what I would like checked out.
Yeah.
So typically I'm getting a full history. It could be a medical history, a surgical history, a family history. It's a lot of questions that we're asking to see how exactly we got here today with this symptom or problem or concern that we're having.
Okay.
Because they help us figure out what's going on. And then we review the medical chart. Oftentimes before we walk in the room, we look at the labs, we look at the vital signs, and we look at the patient and see how long has this been going on. We assess for like the severity of symptoms, how it's affecting your life. What can we do to make you feel better? How conservative do you want to take this, or do you want us to go all in and order every test, to get this figured out right now? How urgent is this to you right now affecting your life?
So it's really tailored.
Absolutely.
Yeah.
Different for everybody.
That's so great, because then, it really helps the patient feel in control, which they should be.
They are. I always say that. Absolutely. We're a team.
Yeah.
You drive the ship.
Wow. That's fantastic.
Absolutely.
So tell us a little bit about why it's great to have a primary care provider. We call them a PCP. Why primary care plays such a big role in someone's health. Because someone may think, well, it's just going in, you're going to look at my ears, you're going to ask me some questions that are maybe a little personal. Why is that important? Why does that make a difference for someone's long-term health?
Yeah. So it's really important because we have a medical record on you then. We know you well. We've seen you for your yearly physicals. When things are going on, we can squeeze in a same-day sick appointment. We are trying to prevent unnecessary emergency room visits. We want to keep an eye on your health. We want to be monitoring your labs. We want to focus on preventative care, keeping you healthy. So people say, I'm healthy, maybe I don't need a primary, but everybody needs a primary, because then if you needed a referral somewhere, often it has to come from your primary. So it's always great. There's not a person that doesn't need a primary.
Okay. And I'm assuming if you take a prescription, a medication, something like that, it's probably really helpful to check in with your primary care provider, especially since they're probably going to be the referring provider for that prescription, the one ordering it. How do you kind of help patients monitor a medication that you're kind of maybe, wondering if they should still be on it, or dosage, things like that?
Yes, absolutely. So when they come into the visit and maybe they're asking for a medication refill or they need a medication, we're seeing how long you've been on it. Are you taking it every day? Do you need a refill? How is it benefiting your life? Are you feeling better? We're not just keeping you on a medicine, to refill it. We want to assess how you're feeling. We want to make sure you're taking it. And if you're not, why aren't you taking it? Do you not feel good when you're on the medicine? What we need it for, continue to educate, look for side effects, and just make sure everything's going okay.
Yeah, that's wonderful. Well, lastly, before we close, I'm assuming you're accepting new patients, right?
Yes.
You always are.
Yes.
I know you're busy,
absolutely.
but you always want to squeeze someone in.
We always want to help. We are here to help. Absolutely.
Tell us a little bit about what a patient should do if they're interested in getting an appointment with you or another one of our Hillsdale Health and Wellness primary care providers.
Absolutely. So you could just call the office and then tell the front desk that you'd like to set up for a primary or what's going on, and they will get you scheduled.
Perfect.
Yeah, we have a great team. So
that's so easy.
Yeah, there's a ton of people to choose from.
Wow. And you do same day appointments as well, don't you?
Yes, and we do virtual visits. So like days like today when the weather was really tough, we can easily off my chart. We do a my chart video visit, and I can see you, and we can still get the visit done. So you don't even have to come out.
Is that kind of difficult to navigate? How easy is it to get on that call?
And if you've never done it before, our medical assistants will walk you through.
Wow.
So we do refills. There's people that have thought that we can't do refills off that visit. We absolutely can. We can take care of you virtually, especially when the weather's like this.
That's amazing.
Thank
you, Rihanna, for the work that you're doing. You're doing an amazing job. It's very exciting because Rihanna is also now has a new position. You are the director of our nurse practitioners. Is that right?
The APP supervisor.
APP
clinical
supervisor.
For family medicine. Yes.
That's so exciting.
It's super exciting. I just get to help out more. I love our team. We have a great team. We always have, luckily. So Yeah.
Okay. Well, I'm going to ask you one more question. I know I said that was the last one, but actual last question. You have a few more letters after your name than some other providers. So you're a family nurse practitioner.
Yes.
But you also provide mental health services. Tell us about that.
So I've been a family nurse practitioner for 10 years now. A few years ago, I approached the hospital and told them that I saw a huge need for mental health and I wanted to go back to nurse practitioner school again for psychiatric mental health. So the hospital supported me in that. That's a huge passion, and I still love family medicine. So I still have my family medicine practice. And now I do psychiatric mental health as well for kids, pregnant women, adults across the lifespan. Yeah, so I get to do both.
That's amazing. So what is the kinds of mental health conditions that might lead a patient to want the kind of primary care, mental health care that you provide?
Sometimes we do stress, we do alcohol misuse or alcohol use disorder. If somebody's really struggling with alcohol, we do stimulant use disorder, so like methamphetamines. We do opiate use disorder, so substance use disorders. Depression, anxiety. We do there's something called agoraphobia, where you're afraid to leave places. So a lot of times we'll see them from home, so they don't have to come out. Bipolar disorder. Basically anything where you're not feeling your best self and you're like, I just don't feel like I used to. I'm not liking things like I used to. I'm maybe not going out and doing things. What's going on with me? We just talk it through. Sometimes we refer you to a therapist. Sometimes people need medication. It's just an open conversation so that people can feel better.
Absolutely. And since you also have primary care, I'm sure that provides a great kind of overall picture of how maybe your physical health and your mental health are kind of intertwined.
Absolutely.
Work together.
Yes.
That's amazing.
Yes.
Thank you
for
the work that you're doing.
Thank you guys for coming out.
And we loved talking to you and talking to everybody here. You have a great team.
Thank you so much.
Thank you so much for joining us for today's Hospital Rounds video. We saw primary care and this great walk-in clinic that we have here at Hillsdale Health and Wellness with Rihanna and the wonderful team of providers and staff here out at the clinic. If you are interested in getting started with a primary care provider, you can visit hillsdalehospital.com/primary care to see all of the providers and information at HHW, as well as all of the other primary care clinics that are throughout Hillsdale, Reading, and throughout the Hillsdale Hospital system. To learn more, visit our website, call us. We're happy to answer any questions that you have, and we'll see you soon with our next Hospital Rounds video.